This is a nicely detailed picture of the spinal cord, right? Not the vertebral column, which encloses the spinal cord, but the spinal cord. And this nice picture, it divides it into 4 areas: cervical, thoracic, lumbar, and sacral. And aren't we happy that that corresponds to what we learned about the vertebral column? There are some things specific to the spinal cord, though. It goes from the foramen magnum, the big spine hole in the skull, and it goes to your L2 vertebra, which is higher than you think. On this picture, it's up here. You might think it's almost like the lower section of your mid-back. You wouldn't be wrong. There are 2 enlargements of the spinal cord. We'll talk about what they do and their purpose, but you can see them here. There's the cervical and then there's the lumbar, and the spinal cord, its diameter gets larger in these areas. Down at the bottom, what happens is that you keep growing. Your spinal cord, you keep growing in height. So your legs and your hips, your abdomen keeps growing, and your spinal cord doesn't keep up with that. So your spinal cord comes to like a cone shape here called the conus medullaris. And you can see it, it's really tiny. But the conus medullaris is the end of the spinal cord. And the conus medullaris is attached, this green line that runs here, it's attached to the sacrum by this little thin filament called the filum terminale. The cauda equina is a term that many of us may know, and it means horsetail. And what it refers to is all these nerves that kept elongating with your growth, even though the spinal cord itself could not keep up with that growth. Here's a better picture of the spinal enlargements. And what's nice about this picture is it shows you cross sections of the spinal column. I like this one up here at the top that shows you some of the nerves that are connected to it. So take a look at how the enlargements have lots of gray matter in them. And that's because the enlargements have neurons that go to serve the limbs. So it's a little bit more area than what you kind of have in like in the thoracic region. So we have the cervical serving the arms, the lumbar serving the legs. I found this picture many years ago on the bottom left. I like this because it lets you know that there are roots leaving the gray matter. So even though we see it like a big mush here, there's strands of neurons in this gray matter here that are synapsing, connecting, leaving, entering. Before we go any deeper into the structure of the spinal cord that you see here, I want you to know that the spinal cord has white matter on the outside, gray matter on the inside. So it's got a chocolate center. In contrast, the brain is just the opposite. The brain has gray matter on the outside and a juicy candy center of white chocolate. So the white matter that you see here in the spinal cord, you have to think of the white matter as neurons that are kind of like coming out of the picture at you and heading up to the brain. They're bringing information to or from the brain, right? So some neurons could be headed downward, some neurons could be headed upward. And these are called tracts. But you have to think about that when you're looking at this, white matter that has no shape or detail to it on pictures like this. The gray matter, in contrast, is providing an area of synapse. So neurons enter into this area and they synapse with other neurons that leave. And this is the direction of information flow. It goes in on the back of the spinal cord, synapses, and then leaves the spinal cord. That's kind of a picture of a spinal reflex right there. Information in, information out. Okay, all right, so let's work from the outside in. And the spinal cord has its own wrappings. And we've come to learn that all of the wrappings for all of the all of the organ systems, they come in threes. Yep. They do come in threes. That's all I can say. Take a look at this picture here. It's showing you the wrappings. Here's one right here. It's showing you that it's peeled away. You can see the other one underneath, and then even another one. These structures up here, that's the spinal cord itself. So the gray, the blue, and then that kind of veiny one are the spinal wrappings or meninges. Singular meninx. Let me write that because I love that. Meninix. That's singular. So the dura is the outermost or most superficial, and it is full of dense collagen that's like attaching it to the organs around it. And we've come to find that this is what the outer wrapping of most of our organs is. It's like an attachment to things around it. The dura mater actually connects through the skull and surrounds the skull, surrounds the spinal cord, and connects to the sacrum. So it's like reinforcement of that filum terminal that we looked at. Between bone and the dura mater, let's look at that at the picture on the bottom left. This thin little cutout right here, that thin little cutout, is the dura mater. It's not that it's hard to see, but you have to look carefully. And you can see that there's adipose tissue between the dura mater and the bone. And this is called the epidural space, right? So this is a space and it's filled with fat. And there are some areas where it's filled with areolar tissue as well. So a little bit of both. This is where you may get injections if you have compression of the spinal cord at any level. Let's say that you have let me just draw two bones here, and you have a disc between them, and here's your spinal cord. And let's say your disc blows out, right? And you have compression of these two. What you can do is we can insert a needle into this area and inject cortisone, which is a lipid-soluble drug that reduces inflammation. The inflammation reduces, allowing your body to heal and mediate the compression. So you can see that up here on the right. It's not an easy area to find, and this is why sometimes epidural shots of cortisone for pain relief, sometimes they don't work. Sometimes they're not in the right area. Sometimes you think you're in the right area. It depends. It depends if you have somebody good doing it, if they have good radiology, if you don't move, and if you have space. Some people just naturally don't have a lot of space there. All right, moving forward. There's the dura mater, and if you peel it away, there's the arachnoid mater, which is in the middle. First thing you think of is spider. Yes, the arachnoid mater is named mostly because it has a spider-like appearance, spider web-like appearance. It's got lots of filaments, lots of area. It's like a network or a mesh. And we can't speak about the arachnoid mater without mentioning the pia mater, which is like a stocking that clings to the spinal cord. What I want you to see in this picture here is that between the stocking on the spinal cord and the arachnoid mater that we have here is a space called the subarachnoid space. This is what we tap with a needle for spinal taps. This space is not filled with connective tissue. This space is filled with spinal fluid, which is also called cerebral spinal fluid or CSF. Oh, there we go, area of spinal tap. I didn't know I added that. So if you want to draw like your own diagram of the spinal cord, you can kind of draw it like this. It looks like a butt that has a big crack on one side and a little divot on the other side, and I guess an anus in the middle. I'm sorry, it's a central canal is in the middle. So it looks like a little butt, and that is what you have here. You have the butt with the big fissure on one side, the sulcus on the other side. And the sulcus and fissure lets us know that this is the dorsal side of this picture, and that this is the ventral side of this picture, right? And we're going to use these terms, dorsal and ventral, instead of posterior and anterior for the spinal cord and for the brain. We use that terminology. The central canal in the middle is obviously it's a place where the cerebrospinal fluid is. Coming off of the spinal cord, we can draw these things called roots. And they're hard to see in this picture. You wouldn't know where they are, I'm telling you. This and this are dorsal roots, and this here and this structure here are ventral roots. So we can draw that on our little picture of dorsal and ventral roots. Those are neurons entering and leaving this area. In fact, neurons entering enter through the back. Neurons leaving leave through the front. And they actually combine together here into a two-way street. We could draw that on the other side as well. We have neurons that are entering from the back and neurons that are leaving from the front, and they combine for a very short piece right here. So the dorsal root actually has this big zit on it that's called a ganglion. Plural, they're called ganglia. And that is before they join together into a two-way street. You can kind of see that here. They show it to you here, and there's a big one over here, which I think is better labeled, actually. But we'll talk about what it is. I just want you to realize where it is right now. The place where there's a two-way street, where the neurons pass each other and the roots kind of join together, that's called a spinal nerve. And that's actually where these neurons are coming together and leaving the vertebral column. That's where they punch through their protection and leave out into the body or come from the body. So it's hard to visualize this, but this structure here that you see is like trapped within the bone of the vertebral column. Okay, so we just did some macro anatomy of the spinal cord. The fissure, you can see the medial sulcus, central canal. But let's talk about the gray matter specifically. If you want to do your own little drawing, if you draw the butt of the spinal cord with the big butt crack right there, central. The gray matter of the spinal cord does this like weird moth, maybe bat-like butterfly kind of thing. That's how I like to draw it. And the pointy things are called the horns of the gray matter. So like your book shows this is the ventral horn because this is the ventral side. It shows that this pointy here is the lateral horn. And you even have a dorsal horn because this is the dorsal side. That's why I like my picture up here because I have these points that correspond to each of these areas. This is just anatomy right now. When we talk about what gray matter does, we're going to use this. We're going to say blah, 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 blah happens in the posterior horn of the gray matter. So it's useful to realize these words horns mean the points on the gray matter. Oh, I'm so sorry. I always forget this. Gray matter, there are neurons that cross from one side to the other. And they do that right here. A crossing from one side to another, from left to right, is called a commissure. And there's the anterior, which is ventral of the central canal, and the posterior. So neurons can enter into the gray matter and then send their information across to the other side. The white matter is a little bit more difficult to understand because, like we said, the white matter really consists of all these neurons or strings going up and down. And this white, the blobs on pictures don't really help you visualize that. So in general, for white matter, we have columns. We have the posterior column, which is bounded by the dorsal horns of the gray matter. We have the lateral column, and then we have the anterior columns right here. Sorry. Sometimes these are called ventral and dorsal. You know, it depends on what book you use. So Just know that they're front and back. A ganglia. I'm sorry, a ganglion. What is it? Ganglia are plural, so it's a bunch of them. Well, anatomically, a ganglia is just kind of like an area of increase right here on the dorsal root. You have ganglia out in your peripheral nervous system. Let's just keep it to the ones right here in the central nervous system. Why are they an enlargement of the root? What is there that is making this so enlarged? It's the cell bodies of sensory neurons. So take a look. I like this picture. This is a sensory receptor right here. It's receiving tension and pressure. And it's sending information through this neuron. The neuron enters through the dorsal root, and its cell body is housed here in the root. Remember that sensory neurons are unipolar, which looks like this. This is where their cell body is, right in the center. We had been talking about multipolar neurons that have their cell body at one end. So remember, we talked about unipolar, and this is just a different structure. So we are simplifying the anatomy. And if you're like, oh my gosh, we're simplifying it, like it's already complicated already. It is. The anatomy of nerves entering and leaving your spinal cord is not simple. And we are simplifying it. This picture here shows you how complicated it is. We have neurons that are entering into your spinal cord, synapsing with another neuron, maybe crossing over to the other side, synapsing with yet another neuron that is now leaving the spinal cord and going to somewhere in the body. Maybe the information comes in the spinal cord and then goes up to the brain using some of the white matter. Yes, it's tough.